Today, we're going to be talking about IUDs. An IUD is a small T-shaped device that is put into a person's uterus by a healthcare provider in their office. The IUD can stay in place for about 5 to 10 years or be removed at any time by a healthcare professional. There are many advantages to having an IUD in place. These include the IUD is always in place, and there's nothing that you need to do before you have intercourse. It is a good method for people who are breastfeeding after 6 weeks postpartum or who cannot use estrogen. It is immediately reversible with no long-term effects on fertility, and you can become pregnant within 1 month of an IUD removal. Some disadvantages of IUDs include that you need to have at least one visit with a trained healthcare professional who can insert the IUD, that you need to have a pelvic exam for insertion, and insertion itself can also be uncomfortable. IUDs do not protect against sexually transmitted diseases, including STIs or HIV. And many people have crampier or heavier periods with a copper IUD. Many people also find that they have spotting or irregular periods for about 3 months after a progesterone IUD insertion. There are 2 types of IUDs that are available. These are the progesterone IUD or the copper IUD. The progesterone IUD includes brands like Mirena, which lasts 8 years, or Kyleena, which lasts 5 years. The copper IUDs can be used for 5 to 10 years, depending on which one you select. The progesterone IUD can be used as emergency contraception for up to 5 days after intercourse, and the copper IUD can be used for up to 7 days after. Progesterone IUDs are made up of plastic and hormones, whereas copper IUDs are made up of plastic and copper. Progesterone IUDs prevent pregnancy by thickening the cervical mucus to block sperm from entering the uterus. They can also thin the uterus lining, making it a good choice for people with heavy periods. The copper IUD works by changing the acid inside the uterus to make it unfriendly for the sperm and egg, preventing the two from meeting and fertilization or implantation from happening. IUDs are often quoted as being 99% effective, and they are very safe. The 2 types of IUDs have different benefits and risks. The progesterone IUD can cause about 3 months of irregular bleeding and spotting, whereas copper IUDs can cause heavier periods. Progesterone IUDs often result in light or no periods, whereas copper IUD periods are often longer and more painful than before. About 20% of people with progesterone IUDs have no period after 1 year, whereas patients with heavy or painful periods are not recommended to have copper IUDs. IUDs can be inserted by a qualified healthcare professional in the clinic. They can be inserted at any time during the menstrual cycle, including immediately after delivery, 4 weeks postpartum, or immediately after an abortion. And removal of an IUD is a quick and easy process that can be done by any healthcare provider in a clinic. Who can get an IUD? IUDs are an excellent choice, and they are safe and effective for most people. You should not use an IUD if you have an active pelvic infection, but an IUD can be inserted after treatment. We also can't insert the copper IUD if you have a copper allergy. IUDs cannot be inserted in people who are already pregnant or who have unexplained vaginal bleeding. Certain types of cancers or tumors may prevent you from being able to get an IUD, or if you have an abnormal cervix or an unusually shaped cervix. If you have more questions or need more information, you can go to optionsforsexualhealth.org, sexnu.ca, or kyleenaandmarina.ca to learn more.